14. That's how many people have died in Maine's prisons and jails this year, according to the Maine Prison Advocacy Coalition. The same organization reports a majority of those who died had unrelated substance use and/or mental health disorders. This week we spoke with the York and Cumberland County sheriffs, who say right now their jails are very understaffed with correctional officers, forcing some officers to work longer shifts. This also forces jails and prisons to forego services advocates say those in the system need to honor those lost and raise awareness about substance use disorder and mental health. Family members and friends gathered in Augusta today. News Center Maine photojournalist Adam Paul shows us why they're calling for change.
Yeah, so we're here because we've had an alarming rate of deaths happening in our county jails and our state prison systems, and we're all here just to recognize that nobody who goes to jail deserves to die.
We know that people with substance use disorders, people who are unhoused, people with mental health challenges make up a huge majority of the people who get incarcerated in this state every day. We've got to do better.
There aren't many families left in Maine who haven't been affected by the opioid epidemic and by the crisis of mental health in our state.
People need to get the help that they need, and it's not a matter of crime and punishment. It's a matter of support and recovery. So we need to provide those services in the community rather than just behind bars.
The research is really clear that the opposite of addiction isn't sobriety. The opposite of addiction is connection. And what we're doing at the Maine Recovery Advocacy Project is we are just reaching out and connecting people. We're loving people, and we're trying to help them get to a better place.
If you had cancer, we wouldn't send you to jail for treatment. So if you have an issue with drugs for whatever reason, why are we sending you to jail for treatment? You're not getting treatment. You're getting punished, and you don't deserve to be punished.
Every time somebody passes away in a county jail, we lose somebody from our community. That was a brother and a son, a father, a mother, a sister, and really none of us should be okay with that.
Many of us spend lots of time trying to find detox beds, trying to connect people to a therapist.
I think first and foremost, we just need to recognize people's humanity, right? That people struggle in our society, that we've all had our own struggles. And I think it's really easy to take a side on issues like this, but it becomes less easy when it's somebody that you love. And so I just ask people to empathize and say, what if somebody that you loved went in the county jail suffering from mental health disorder and ended up taking their own life, or dying from a drug overdose, or really dying in any way? It really boils down to the fact that a lot of people that are passing away in our system, are doing so because of issues directly related to mental health and substance use. And a jail or a prison setting is no place to treat those issues.
We intend in this coming legislature to be present here, right there at the State House, talking about ways that we can do better.